Meanwhile, children now make up about 11% of the total positive COVID cases in the U.S.
Our Ainsley McCall has more on the numbers and what local doctors are saying to parents tonight.
The American Academy of Pediatrics is reporting a 14% increase in pediatric COVID-19 cases, which is not all that surprising given that we're seeing rising positivity rates all across the country. But even so, we wanted to ask doctors if they're seeing more severe cases as a result. And the good news is, so far, local hospitals are seeing relatively low hospitalization rates for pediatric patients, with the state showing less than 20 pediatric hospitalizations due to confirmed or suspected COVID. In fact, children tend to be asymptomatic or have mild symptoms unless they may have congenital or chronic illnesses. So when doctors do find a child to test positive, many times it's considered incidental. Doctors, however, can see more severe cases in teenagers and want all parents to remember that even though young children may not be symptomatic, they can still be carriers of the virus.
I think that's great news that we're not seeing children sick enough to come into the hospital. You do have to remember that even though they're not sick enough to come into the hospital, they can still transmit it to other people, to other children and to adults.
Among the states that report coronavirus deaths by age, the AAP says that children account for anywhere between 0 to 0.15% of total deaths. Meanwhile, the CDC says that trying to understand this increasing trend among children with COVID may also come into light when you consider that kids were not back in school in the spring and they are now, which may also be contributing a little bit to this upward trend in kids. Reporting in Grand Rapids, Angela McCall, Fox 17 News.